My name is Jatin Kothari. I am a nephrologist in Mumbai, associated with the Max Group, the Hinduja Healthcare CAR, as well as the Apex Kidney Care. I have been practicing in Mumbai for the last 20 years. And over the next 10 to 15 minutes, I want to share my thoughts with you regarding your career choices in nephrology after you finish your postgraduate training. First, couple of disclaimers up front. This is not based on any evidence. These are my personal views. And second, we are probably going to have a more abstract kind of a presentation and not based on very strong evidence. So please bear me out on that. Also, this presentation is made on the order from Dr. Umesh Khanna, who's a very close friend and a senior colleague from Mumbai. And hopefully this will help you to make the right choice, what is good for you for your future in nephrology. Obviously, before thinking about settling down in practice, either in India or anywhere abroad, you would have to finish your DM or DNB or fellowship training in India. And hopefully you do it within the time frame where the loss of years don't happen during your training. I am a strong believer that whatever you essentially want to do in the future depends on what decision you take as of date. And this is a famous quote from the father of the nation, Mahatma Gandhi, as to how you need to approach life as a general. And before you take any decisions, there is always this balance that you have to maintain, and the work-life balance, what we call. During your career as a nephrologist over 40, 50 years, it will happen that probably the balance or the pendulum would shift towards the work side for some years. It would shift towards the life side for some years. But overall, the entire career, you will need to achieve a balance between these two factors. And a rough way of looking at it is that during your building years of your practice, especially from the years 30 to 50 of your life, probably this will tilt more towards work. 50 to 70 is probably the time frame where you would want to balance these two and keep the pendulum at an even keel. And beyond 70 years, it usually tilts more towards balancing and managing your life, especially with the future, with your kids, etc., and the family perspective. So this is something that you need to keep in mind. This is overall what my perception has been over the last 20, 25 years of being in nephrology, as to how I look at people, considering the options of working in India versus going abroad and making a career out there. This again is not based on very strong evidence, but there have been some personal communications and some questionnaires which I circulated across a few members from our community. And overall, the perception is that 80% of the nephrologists who train from DM, DNB in India essentially continue to stay in India and practice in India for the rest of their lives. About 10% would go for training abroad, and this could be a short-term training, in some cases even up to 3 months to 6 months if it's a fellowship, or some sort of an award, or even a prolonged clinical fellowship like what is offered in Canada and sometimes even in the United States. These 10% actually come back and increase the pool of nephrologists in India, which currently is only 3,000, as most of you are aware, but come back to settle down in practice, either in the public or private sector in India. About 8% is what I feel are people who train in India and then move abroad on a permanent basis, and they would settle down to become a clinical or a research nephrologist anywhere in the developed world. Most commonly in Canada as well as the United States. And we'll look at the factors as to how this has changed over the years. I would say that only 2% of people who actually study abroad, who have done American boards of medicine or nephrology, come back to India and start practicing on a permanent basis here in India. after obtaining the training abroad. So that's a very, very small minority overall from the entire population. And these are the countries that we are looking at in terms of options available for nephrology trainees after they finish their training. One other point which is very important to understand is that if you are looking at some sort of formal residency, you are probably a little late already if you have done your DM or DMB nephrology here in India, because you've lost at least 4 or 5 years of sort of productive life. So the best time to actually pursue residency anywhere outside of India would be immediately after MBBS, and you probably have spent 5 or 6 years post MBBS getting your nephrology degree. So that itself should be kept in mind when you consider the option of moving permanently to countries like the US. So we'll discuss each of this at length, but this is probably the most important slide of my entire presentation. And as is in life, there is always a pro and a con side of every decision that we make. Looking at obtaining stints abroad, the pros, which are enlisted here, is essentially to try and gain some experience from the developed world, and this was much more a common reason as to why people would go abroad maybe 20-30 years back, where some of the limitations of practice in India with not getting much experience in particular aspects of nephrology practice was happening. But over the years, this has really now become quite common that people actually are able to get better training in some of the centers in India compared to even in the developed world. So this is definitely a pro, especially for people like me who trained almost 20-25 years back, where we didn't get much exposure to peritoneal dialysis, we didn't get much exposure to research, and those were the reasons as to why I decided to go abroad. Earning in dollars is always a good thing, and the dollar keeps appreciating, and our rupee gets depreciated practically every time you look at it. So that's something which can act as a savings when you come back and set up practice here. It will help you to be reasonably assured that your requirements for the first couple of years at least are taken care of while you settle down in practice. One other important aspect which I would consider as a pro is obviously to have a significant exposure to research, whether it's basic research or clinical research. That's something that for sure has more access when you are training abroad or when you're working abroad. And there are possibilities of careers opening up even in industry. And I know of a couple of my friends and alumni from Toronto who've actually taken up career in biotechnology and career in medical research, and they're doing very well. So those sort of options are obviously much more commonly and easily available when you're training abroad or working abroad. Something that was considered a few years back as very important, whenever you look at attachments to corporate hospitals in metro cities, and this is, I'm talking about tier 1 cities, a degree from abroad, a fellowship from abroad would help you to get an attachment to a corporate hospital where otherwise newcomers would face challenges in terms of experience and competing with the established nephrologist in that particular hospital. So that's something which was important, but again, this is now becoming less and less prevalent, except for tier 1 cities where it might still be helpful. In tier 2 and tier 3, actually, most people who are trained in India straight away go ahead and join the corporate hospitals and are able to do good work. Looking at group practice is something which has been, a concept which we've always looked at very seriously. And at Apex, as well as at the hospitals where I worked, it's always been the concept of working as a group of nephrologists. And that's something that obviously each one of you need to consider whenever you are entering into practice. So the whole concept of group practice does evolve, and your thinking probably evolves much better if you are trained abroad. And if you have some interest in a particular area of nephrology, say it's interventional nephrology or hemodialysis or transplantation, these sort of interests can be cultivated and developed much more, because abroad you may be able to focus on that particular area and generate a good amount of work and revenue for that particular program, compared to India, where obviously you will still continue to do most of nephrology and try and develop an interest in a smaller area of nephrology. Evidence-based medicine and you becoming more savvy and having a sort of leadership role in your program also happens when you have some exposure abroad. And this is what I feel is the benefit of training abroad. On the con side, it's important to realize that, by the time you finish DM or DNB or a fellowship in nephrology, you are in this age bracket of anywhere between 28 to 35. So you are essentially going to spend 2 or 3 years, if you decide to do a clinical fellowship or a residency, of some sort of retraining, and that's would be the lag time that you would have whenever you decide to establish practice and come back to India. So that's something that needs to be considered. These are the so-called productive years of life where I thought, where I tried to explain to you that how you will have to balance the whole work-life situation. About training abroad and how much it will be applicable when you come back is also a question that you need to ask yourself. That are you going to be able to do what you have done abroad back home here? Our requirements, our needs, are different. We are only 3,000 of us for a population of 140 crores, and that's the reason why we need to look at possibility of adaptability in practice when we start. Social commitments, for sure, when you are out of India, do suffer, and that's something which is quite relevant for most of us, who are in a society where our commitments to our family, etc., matter to us. For public hospitals and smaller cities, probably any sort of foreign training is not required. You will be able to get an attachment as a lecturer, associate professor, assistant professor, etc., quite easily. If you are a trained nephrologist from India. So probably the training abroad doesn't help you much in that aspect. And the entrepreneurial aspects of practice is something which you will cultivate and which you will develop only when you are back in India. In the developed world, you are more, a piece of the entire puzzle. You're just filling in and doing your job. And the whole aspect of entrepreneurship is not taught much, except for, people who are sort of program directors and who are at the higher level once you are more senior in practice. And I have been a part of, groups like the ANIO, where I see a tremendous entrepreneurship across the world from nephrologists who are trained either in India or even in the developed world. Finally, we all know that medicine is a combination of how you balance the art and science of practicing medicine, and that's something that you need to consider before taking the options. Now, coming to the point of who can guide you and give you the right perspective, and these are the common set of people who can help you. In today's world, we have all these global mentors. I call them global mentors because they are from all over the world, and we have easy access to most of them nowadays. 30 years back, it was difficult to get across to any, nephrologist, say, for example, in the United States. And you would have to physically meet him either at some Indian meeting or maybe if you had the chance to go to some international meeting. But as of now, the access to all these global mentors has become much easier with the social media and email. And most of the times at meetings like Avatar and Apex Pathshala and the Indian Society of Nephrology or even the regional meetings, sometimes you're able to connect with all these global mentors easily. And I think they can guide you really well because they have a perspective of 30, 40 years of people who have trained with them, who've come from all across the world, gained some experience at their centers, and they can probably guide you the best. Sometimes the alumni connects also can help. And as I mentioned, I am a part of the alumni group of Toronto. I'm also a part of the ANIO. So all these forums also help you to understand what is the overall global perspective of nephrologists moving from one part of the world to the other. Something that we did very commonly was to ask our seniors, and there is a lineage of trainees who have gone to a particular program. I can give you the example of Toronto, where we've had more than 100 fellows who've trained in a single program over the last 35, 40 years. So starting from the era where Georgie Abraham and Ramesh Khanna started going to Toronto, down up to even till last year, where our students continue to go to Toronto and get good training. And this applies to a large number of programs across the world as of now. And again, something which is very important is just find out from your peers what they are doing and how they apply, etc. And sharing the information with peers also is a good guide for you to, sort of decide whether you want to go abroad. So we'll start with our favorite country. I think nephrology training in Canada is most exciting because we don't require any entrance exam. You can actually have hands-on experience of treating patients almost like as a consultant because of your training in India, the clinical training in India. You are well versed with the entire aspects of nephrology, and that's why you have a tremendous exposure to newer things, whatever is available in Canada. And these are some of the names, and I might be missing out some names, but these are the sort of names that I could think of who can really help you in terms of in which way you want to approach your training and stint abroad. So if it's residency or fellowship or research or even some sort of a visiting scholarship or awards, and a lot of international bodies do still give awards and short-term scholarships for you to train in a particular aspect of nephrology. Even industry-supported scholarships are available. So you can get all this information from the people that I mentioned in the previous slide. And these people whose names are here on this slide can also help you in terms of making a decision. Looking at the United States, again, I would still maintain that probably the most transparent system across the world is the United States, where if you have to do nephrology and take up nephrology as a career, you will have to go through the residency. And that's the difficult part, where you still are going to have 2 or 3 years of retraining, if you may. But still, after the end of the training and fellowship, you will be at par with all the, local American nephrologists, and your career could also take off. And most of our colleagues from the Indian community or Indian origin nephrologists who are practicing in the United States are actually in high positions, and they're doing very, very well. And some of their names are put down on this slide who could help you to decide on residency programs, which residency program should be preferred, etc., if you're going that route. For fellowship, people like Prakash and Tushar Vasirajani can really guide you as to how you should select a particular program, etc. A lot of Indians who've done phenomenal work in research, and it could be clinical research, it could be basic research, and all these people can also act as a source of information and guidance. And of course, there are some groups where in the United States which are very heavily dominated by Indians in these programs, and they can again look at guiding you for a visiting scholarship or a short award, over a short period of time. Looking at the Australia and New Zealand as that part of the continent to look at a stint abroad. Again, residency, fellowship, research, we have enough people now trained in India who have now migrated and doing excellent work, and these people can again guide you. Mind you, Australia and New Zealand, there is a lot of time that is lost because you will have to retrain, you will have to look for opportunities, and opportunities are far and few across the country because there is a set pattern of how nephrology practice is done in these countries, and you will have to go through the grind of trying to find proper information and get an opening. And some of these people on this slide can help you do that. Interestingly, in the last 20-25 years, we've seen a few nephrologists, especially from Mumbai and the western part of India, migrate to even the United Arab Emirates. And as we all know, United Arab Emirates are a conglomeration of 7 countries. And Rajaram, Amitabh, all these nephrologists who are practicing there could also help you to take a decision whether you want to move there for good, for practice. There are obviously some challenges and some limitations of practicing there, but huge advantages also in terms of reimbursement patterns. As we speak, there are actually transplant programs which have been established in the UAE, which was sort of missing for the last 20-30 years. But people like Sai Venkat, etc., have started transplants even in the UAE and doing excellent work. So this was all about, going abroad and having a stint, having a training, and then thinking about whether you want to stay back or come back. What about the 80% who are going to stay in India and, have practice and do nephrology for the rest of their lives in India? And as we speak, the last decade or more, we've seen more and more opportunities to learn while you are on the job in India, and all these wonderful social media platforms, and some of these are strongly driven by Indian sort of origin nephrologists across the world. Along with all the online courses, there are fellowships in transplantation. There is a GlomCon, which trains you about glomerular disease. The ANIO courses, which were, have been conducted for nephropathology and clinical nephrology over the years. Board review courses, which could also, in a span of 6-7 days, give you a great perspective about how nephrology is practiced and considered as an option across the world, etc., are all the options where you can actually learn on the job once you even become a consultant. And, it's some sort of a continuous medical education. And these are some of the things which I highlighted in the previous slide. Wonderful programs of, getting knowledge from across the world, even sitting back in India. And each of these programs are unique in its own ways. Focusing on fellow training, focusing on people who are already qualified nephrologists to start some sort of a social media initiative. And even for senior nephrologists, some of these programs are very, very exciting. I am particularly thrilled about NEFJC, which is a wonderful platform set by Swapnil and Joel Top, which keeps you updated even day to day about what are the advances in nephrology. And these are all the tools which are available across the world, and especially in India, most of the people have really gone on to make a name in this. So I would end here by saying that this famous quote that what if grass is greener on the other side? And the grass always looks greener on the other side. But you have to consider that, if you were probably on the other side, the grass right here in India also would be looking green from that side. So this is something that you need to keep in perspective and keep in mind while you make this decision. And I would end by stating again this famous quote from our father of the nation, that you have to be the change that you wish to see in the world. And this is the way I approach life, I approach my work, and I'm hopeful that this presentation will help you make the right decision for yourself and your family. I would be very happy to exchange notes with you, or any comments or any questions that you have. My email address is jkothari1970@gmail.com, or you could reach me even on my WhatsApp, which is 9820-121010. Again, thank you for your attention, and thank you, Dr. Khanna, for giving me this opportunity of sharing my views with the younger nephrology community, as we call the next gen nephrologist in India. Thank you very much.